Hello. Hey guys, welcome back. So today we are going to be spilling the tea on the differences between UK nursing and Canadian nursing. So I hope you guys enjoy. I think I came up with about 5 different differences that I've noticed from the position that I'm working at right now and what I've noticed from back in Canada when I was a student and was doing placements and things like that. So yeah, let's get into it. So differences, UK, Canada. So obviously when you're in Canada, at least I found when I was in nursing school, whenever I looked up whenever I looked up anything, a lot of the times I would find information on like UK sites and stuff like that. So the idea back like in Canada was like UK was like the top notch for like nursing or like nursing education, and it was like nursing education was founded anyways in the UK, right? So yeah, so to come here and like see kind of some differences, I was kind of like shook and I was like, whoa, what's going on here, you know? So let's get into it. So first and foremost, become a registered nurse. In the UK, it's a 3-year program. In Canada, it's a 4-year program, okay? In the UK though, you have to pick your specialty right away. So you have to pick whether you are going to do adult, child, midwifery, or mental health nurse. So you have to choose one of those 4. As soon as you apply, when you're fresh, 18-year-old, however old you are, when you're applying for nursing, you have to decide which one you want. Whereas in Canada, it's a general 4-year program, and within that 4 years you gotta kind of like dip your fingers and your feet into the different specialties. So you do a little bit of peds, you do a little bit of mental health, and then you do a little bit of maternity, and majority of it is all adult. So you can see what everything is. And then once you're done in school, you can go ahead and kind of like specialize towards where you want to go. And depending on that, you might have to do a little bit more courses for that. Here in the UK, people go adult and that's it. That's all you do, adult. And all your placements and everything is geared around adult. You do child, same thing. So I think it's it makes it a little bit harder to kind of switch into or transition into different things. As of right now, I'm in the process of registering to become an adult nurse. Who knows what the future will hold, because I do have a little peds in me, so I might, I don't know, try and see if I can get a peds registration, but as of right now, I'm gonna just be doing adults. So then the second thing that I've noticed, number 2, a lot of us in Canada, we wore scrubs, and we got to decide what kind of scrubs we got to wear, and we can have all these different prints and, you know, jazz it up a bit. In the UK, it's trust-based, so when I say trust, it's like the hospital based, and so it's depending on what kind of uniform you wear. So the trust that I currently work at, we wear a uniform, and it's a set uniform. It's kind of cool though, because there's like a different colored scheme uniform kind of way. I don't know, nurses, like if you're a band 5 nurse, you wear like a blue, so it's cool because everybody, depending on your job role, whether you're a physio, you're a pharmacist, you're ultrasound technician, like everybody has their own set of uniforms and what they wear and stuff like that. So it's kind of cool because you gotta know what the difference is. I'm still learning, and I go up to people and I'm like, what's your uniform, like what's your job role, you know? So that's kind of cool. But yeah, you have to wear the certain uniform. They're kind of like scrubs, but yeah. So the only people that wear actual scrubs are like doctors, or if you forgot your uniform or something, then you just go downstairs. Or if you work on like an isolation ward where you can't wear your uniform, you wear scrubs, reusable ones. So then, yeah. Next one, number 3. Is that 3? Yeah, number 3. Oh, I think this is where we see this beautiful stethoscope here. Stethoscope is something that I came to realize isn't really used very often as nurses in the UK. So when I first moved here, I actually had forgotten my stethoscope in Canada because I moved here in such a rush, right? And I didn't have time to pack almost everything that I needed. So I came here in such a rush, and I only sort of brought myself and whatever else. So I didn't bring my stethoscope. Finally got a job. I was like, oh, I need to buy a stethoscope. But we know how Littman stethoscopes, how expensive they are sometimes. So I was like, no, can't pay for that. So I went on Amazon and bought a little, I feel like it was like 20 pounds. Something like that. So I bought one of these stethoscopes, and I was so ready for my first day, going in, got my stethoscope, my notebooks, everything ready. And then I go in and I look around and I'm like, no one's wearing a stethoscope. Nobody has a stethoscope around them. So I was like, okay. So I kind of like left mine in my bag, you know, just trying to feel it out or whatever. And then I think like my third shift or something like that, I can't remember, or maybe it was that same shift, I can't remember, but I went to talk to the matron, the clinical matron, and I was just like, hey, I just noticed, like, do we not use stethoscopes here? And then he's like, oh yeah, like, in order to like actually use a stethoscope and listen to the lungs, you need special training to do that. So I was like, oh, okay. So I was like, okay, well then how do we do like respirations and like how do we check the lungs and stuff like that? And he's like, oh, like just do the, oh, that's a pulse.
Oh my God!
He's like, oh yeah, like just, you know, look at the inhalation and exhalation of their abdomen or wherever, you know, like just look at them and like, you know, count that for a minute or so. So I was like, oh, okay. So I guess that's all we do here. So when you do your obs or your vitals, you don't listen to the lungs or the heart. Just kind of like look at the respirations. So I was kind of surprised at that when he said that you need extra training for that, just because in Canada, that's something that you get taught like from, you know, first year, and then when you are done nursing school, you should be able to listen to the respirations and listen for congestions and things like that. So this has not touched a patient or has not touched anywhere. So it's just been sat here collecting dust until I probably get that training to be able to do that. And I don't know, I haven't looked into like who gets qualified or if anybody can do the training and stuff like that. So I've also noticed that a lot of skills in Canada you get taught and that you are able to do once you're done your education aren't skills that are necessarily that you're able to do here in the UK without further training. So skills like IV insertions, venipuncture, NG tubes. These are just the basics, right? Certain types of dressings like vac dressings and catheterization, only male catheterization though, female is fine. So all of these skills you here in the UK you have to go and do extra training for. And I don't know what the education system is now, if they are training the new nurses to be able to get out of school with these skills, but I know a lot of the nurses had to go and do these extra training. That was something that I was like, ooh, kind of took me back a bit. So because I had to do all that, I've registered to do a few of them. But the thing is, some of these training courses are like months and months in advance, like fall. It was like December. I registered for a venipuncture course, and that's coming up in February. That was the closest one I can get. But then when it came to cannulation, the closest one I can get is probably like July. So I don't know. I'm excited to do the venipuncture one. I'm hoping, because the cannulation one is like they're right back to back, so I'm hoping maybe they'll let me slither my way through into the cannulation one. Same with IV medication administration. You have to take a course on that as well. Number 5. I think I'm at number 5. Yeah, I think I'm at number 5 or 4. Because certain nurses don't have the certain skill set in terms of like certain like say cannulation. If certain nurses can't cannulate and you only have one nurse on shift or 2 nurses on shift that can cannulate and they're not able to, you're gonna have to call the doctor to come in and cannulate this person. Same with taking bloods. If the nurse is not trained to take blood, or there's nobody on shift, or just for some reason if the nurses and people can't do bloods, then the doctor has to come and do bloods. And the trust that I work at right now, I do see a lot of doctors coming in to take blood as well as do cannulations. Again, sometimes it's also just because we've tried or they've tried a couple times and they just weren't able to get it, so then the doctor has to come in and try. But so from that perspective, I saw that the doctors were kind of like more in there in terms of like doing all that, whereas when I did my consolidation in Canada, I saw the doctors maybe. So I just see like the doctors are more, they seem to be a little bit more hands-on here in regards to like actually doing some skills, because if we can't do them, or if you're not trained to do them, then you just wouldn't do them. Those are just some of the differences that I've noticed. I'm sure I'll notice a little bit more, good and bad, so I'm not saying any of these are good or bad, it's just differences that I've noticed in my position right now. So I'm not a registered nurse at the minute, I'm in the process of a registered nurse, but the position I'm in allows me to be able to observe and see these differences. So I don't know, might have an updated version when I become a registered nurse, so we shall see. So guys, let me know if you liked this video and if it was useful or whatever, and let me know if you want more. Like, subscribe, and share with your friends, because you know what, like, we are on the road to 100, so let's get it. Bye guys.